Hello, everyone. In this revision lesson, we would be evaluating the behavioral explanation and the psychodynamic explanation of fear-related disorders, including a discussion about longitudinal studies. So we all by now, I'd like to assume, know that longitudinal studies over here would be our named issue. We all by now should be aware that these evaluative questions, they follow a descriptive question that is of 6 marks. So we have picked up this question from May, June 2024, A2 Psychology, paper 3, variant 3.3, question number 4B. As we start with this, as we start with discussing the marking scheme for this particular question, you'd see that this marking scheme in itself is so elaborative and so self-explanatory that uh, if you be a little honest towards yourself, and if you spend a couple of minutes reading through this thoroughly, you'd understand it all. So evaluate the behavioral explanation and the psychodynamic explanation of fear-related disorders, including a discussion about longitudinal studies. Evaluation in your answer can include strengths, it can include weaknesses, and a discussion of issues and debates. So to begin with, the longitudinal study, that is the key issue over here, key issue or the named issue, I'm sorry. If we talk about the strengths of longitudinal study, they are initially some generic strengths, which we can, of course, link with the two example studies that we have as a part of a study. Number one, the study by Watson and Rayner on little Albert, and number two, the study by Sigmund Freud on little Hans. So the first advantage, longitudinal studies showed us change in behavior over time, which is, of course, an advantage. One. Number two, in Watson's study that lasted a few months, 8 months, 26 days until 12 months, 21 days, 4 months, and conditioned little Albert to become afraid of rats, white fluffy objects, etc., over the course of time. So was the case with Freud. Freud's study lasted from age 3 to 5 years and investigated the development and resolution of the Oedipus complex during the study. One. Number two, longitudinal studies are often in-depth as time to collect a data, as there's a lot of time to collect data. Example, the study that was conducted by Freud, the study that was conducted by Freud on the young boy little Hans. In this study, there was a lot of in-depth data that was collected from letters from little Hans' father describing events and conversations he had with Hans. Next, we could speak about how longitudinal studies are seen to be holistic as well, because they help develop a thorough understanding of the participants in the study. Now, remember, to be able to evaluate something, you need to have a thorough understanding. You need to know what these studies were that were conducted by Watson and Freud to be able to understand this. If you did not know of them, you might as well stop this here, go back, read through the studies really thoroughly and come back. If you still do not get anything, get back to me and I'll help you understand it. So moving on, giving examples through Freud's study and then Watson's study. Freud had a holistic view of the causes of Hans' behavior. For example, he was sent letters with conversations between Hans and his father describing little Hans' thoughts and fantasies. Freud was able to report on how the fantasies changed during and after the phallic stage to explain how someone transitions from one psychosexual stage to another. Whereas Watson was somewhat holistic too. He tested little Albert on a number of different objects to explain the development of the phobia of rats and also how phobias can generalize to other objects similar to the phobic object. When you talk about longitudinal studies, there's no recall bias over here because the data is collected there and then, as the participants doesn't have to remember past events. Both Watson and Freud's through the father were recording events, behaviors, etc., as they occur during the study. For example, little Hans' father did not have to recall events from Hans' childhood, but could record them in his letters as they happened. This automatically makes the data collection or the data that you've collected more valid. So, see, this is supporting the psychodynamic explanation, and this is for the behavioral explanation being evaluated. Look at the comprehensive marking scheme that the Cambridge has provided us. So weaknesses of a longitudinal study. The first weakness, longitudinal studies, because they are studies that are conducted for a long and extended period of time while developing, recording developmental changes. All of this takes a lot of time. There's a fear of sample attrition. What does sample attrition mean? Because of the amount of time that these longitudinal studies take, there's always a possibility that the researchers might lose out on their participants. Now, taking this ahead, in some longitudinal research, participants drop out of the study due to loss of contact, unwillingness to continue, etc. This did not happen during Watson or Freud studies, but the Freud study was very time consuming. A researcher can invest a lot of time in the study, and as longitudinal studies often have one or few participants, if someone leaves the study, this could mean the researcher cannot progress. The research cannot progress, and of course, it's a waste of time in that case. Number one. Number two, the researchers can develop a close bond, which may result in in research bias or the researcher bias. So the researcher can develop a close bond with the participant and can be less objective in interpretation of data, particularly if there's qualitative data. Another two keywords. Freud's research has been accused of being biased as the data was collected by the father who had a close relationship with his son as well as with Freud. So this was the key issue or the named issue. Another issue that we could bring in under discussion. Behavioral explanations are considered to be nurture because remember, they believe it is the environment, it is the experience. So behavioral is nurture as phobias are learned through association between a neutral stimulus and an unconditional stimulus. In contrast, when we talk about psychodynamic, they could be seen as being both nature and nurture. Nature, because we all go through psychosexual stages, but whether we pass through them successfully is due to our life experiences on nurture. So this part is supporting nature, and this part is supporting nurture. I'll just like this and like this. Yeah, moving on. Determinism versus free will. The explanations of phobias are seen to be deterministic. The behavioral explanations suggest phobias are learned. This is deterministic because the person who develops the phobia has no choice but to develop it due to their learning experience. For example, this is an elaboration of the theory that we just read. For example, little Albert learned to be afraid of the white rat because of the noise he associated with the rat, not because he chose to be afraid. However, some elements of free will as a phobic patient can unlearn their phobia too, example through systematic desensitization. On the other hand, if we talk about the psychodynamic explanation, this is also deterministic. Freud theorized that a phobia is caused by the expression of anxiety in the unconscious over which we have no control. In addition, the repression of anxiety occurs due to early childhood experiences over which there is little to no control. However, a phobic patient does have free will to go to psychoanalysis and allow the psychotherapist to help them bring the fear into conscious mind so that it can be resolved. Now, this is catering to both the behavioral explanation as well as the psychodynamic explanation. So you writing down how they both could be deterministic and how they both could be leaning towards free will too. Taking this ahead, if we want to evaluate this in terms of case studies, a strength over here of a case study is that it helps you gather in-depth research. Watson and Freud's both research, they had good ecological validity. A weakness is because the sample is either comprising of a single individual or a very small group, you can say that the findings lack generalizability. As just one young boy, that is Watson and Freud, they both use just one young boy, and researcher can become overly involved, leading to bias. For example, Freud has always been accused of being too biased with his work. If we talk about validity over here, Freud's study is open to bias as data was collected by the father of little Hans and reported via letters to Freud. All data was qualitative and open to interpretation. Little Hans had a frightening experience with a horse which could explain his phobia, and yet this was dismissed by Freud. Watson, on the other hand, Watson's data was collected via observation, noting down the behavior of little Albert. Example, was he calm? Was he fussing? Was he crying? As Albert was a 9-month-old baby, there are no demand characteristics or social desirability, which increases validity. It is unlikely that Watson misinterpreted the behavior of Albert, as the difference between a baby being calm and crying are very clear. Also increasing validity. However, you could say there was poor ecological validity, as no one is purposefully conditioned to develop a phobia. Many phobias develop with just one bad experience with the phobic object. Repeated and systematic exposure to the banging of the iron bar is very unrealistic and lacked mundane realism too. Now, additional points that you could probably use if you want to evaluate this the behavioral and the psychodynamic explanation. You could evaluate this in terms of generalizing from findings. Both the cases had a single individual. Yes, they both collected qualitative data. Yes, the data was subjective. And there could be a lot of ethical issues that could rise when you talk about scrutinizing this research. So this marking scheme in itself is so elaborative. I mean, if you have a basic understanding on if you have a basic understanding on what do you call it, the biological and psychodynamic explanation of fear related disorders, and you know what longitudinal studies are, and you're aware with the uh, teacher advised or teacher advised format towards writing evaluative answers, there's nothing that could hold you back from scoring a 10 on 10. So yeah, I hope this has been helpful. Thank you.